Thank you very much, Professor Pearce, for the opportunity to present Olympia, which has multiple academic and industry partners coordinated by the Breast International Group. Olympia tested the PARP inhibitor olaparib as an adjuvant therapy after adjuvant or neoadjuvant chemotherapy in patients with germline BRCA1 and 2 mutations and high-risk HER2 negative early breast cancer. Next slide, please. BRCA1 or BRCA2 germline mutation is associated with approximately 5% of all breast cancers. An outcome is good for many patients with germline BRCA mutations and early breast cancer receiving standard treatments, but recurrence rates remain high for some, and so additional or adjuvant novel targeted treatments are needed. Olaparib is a PARP inhibitor that targets a DNA repair defect in these cancers and is already approved for treatment in the metastatic setting in germline mutation carriers. Next slide, please. We included germline BRCA mutation carriers with HER2 negative breast cancer who'd completed standard treatments that included chemotherapy. And they'd had those treatments because they were determined to be at higher risk of recurrence. These patients were then randomized to a year of olaparib treatment or to placebo. The primary endpoint of the study was invasive disease-free survival that I will explain more about later. And the secondary endpoints were distant disease-free survival, overall survival, safety and health-related quality of life. Now, stringent criteria were applied for a planned interim analysis, and at this analysis, Olympia's independent data monitoring committee found these stringent criteria were met for early reporting, and that is the primary analysis reported at ASCO. Next slide, please. So these are the main results for the primary endpoint, invasive disease-free survival. So compared with placebo, patients receiving olaparib had a 42% reduction in the risk of the following events: local recurrence of breast cancer, metastatic recurrence of breast cancer, other new cancers, or death due to any cause. And that makes up this endpoint called invasive disease-free survival. You'll see that the hazard ratio is 0.58 and was highly statistically significant, as it needed to be to meet the stringent criteria for an interim analysis. On the right, you see the Kaplan-Meier curves, and you see that these separate early and that there is a difference in the three-year IDFS rate of 8.8% compared to the placebo-treated group in blue. Next slide, please. Compared to placebo, patients receiving olaparib also had a 43% reduction in the risk of a combination of metastatic breast cancer, new cancer, or death due to any cause. And this is the secondary endpoint called distant disease-free survival. The hazard ratio here was 0.57, and again, highly statistically significant, which was required for meeting the stringent criteria for early reporting. On the right, you see the Kaplan-Meier curves, again, separating early and remaining separated with the olaparib curve in the orange color and placebo in blue, the difference 7.1% for the rate at 3 years. Next slide, please. The secondary endpoint of overall survival is inevitably immature at an early reporting time point stimulated by this interim analysis. Although there are fewer deaths reported on olaparib than placebo, the overall survival was not significantly different between olaparib and placebo at this very early time point, given a very stringent test required to declare statistical superiority. And that was to save statistical power for more appropriate time points later in follow-up, given this is only a median of 2.5 years, very early for overall survival analysis. Next slide, please. The side effects of olaparib were consistent with that already known and with the previous studies and the approved labels for olaparib. We noted in this early report that olaparib did not increase serious adverse events, things that lead to closely monitored, like hospital admissions. Also closely monitored events such as the incidence of leukemias or other cancers. So these were not increased in the olaparib group. More significant side effects that we call grade 3 did occur more commonly compared to placebo, as one might expect, and these included anemia, the lowering of level of white blood cell count, and fatigue. Next slide, please. On this slide, these are given to you in more detail. You will see the olaparib arm on the left, and that there is some increase in the lower grade forms of side effect for nausea, fatigue, anemia, and the effects on the white blood cell count. And they're slightly called out for the higher grade, grade 3, in the dark color and enumerated, but you can see these are infrequent. Next slide. So in conclusion, the Olympia study is the first study to report the benefits of a PARP inhibitor, olaparib, as an adjuvant treatment for early forms of germline BRCA-associated cancer. Patients who received olaparib after surgery and chemotherapy were more likely to be alive without cancer and avoid metastasis than patients who received placebo. The side effects were limited and manageable, and as expected from the experience to date with olaparib. And these results suggest olaparib for 1 year after standard of care treatments provides meaningful benefit to germline BRCA mutation carriers with high recurrence risk HER2-negative breast cancer. They also show that germline testing for BRCA1 and 2 mutations provides important information that can influence systemic therapy in early breast cancer. Thank you very much. Next slide.
Thank you, Dr. Tutt. These results are so important since, as you said, about 5% of all breast cancers are associated with the BRCA1 or 2 mutation, and some of these cancers are indeed aggressive. And as you nicely summarized, this study demonstrates a significant reduction in invasive recurrences thanks to 1 year of oral olaparib and a significant reduction in distant disease. And I think this, again, further highlights the importance of genetic testing in appropriate patients. In appropriate patients, so that we know which patients will benefit from this therapy. And I think it may even open the door to additional trials of adjuvant PARP inhibitors for other BRCA1 and 2 associated cancers. So very exciting data. Thank you.